Hello, everyone. My name is Dr. Lauren Pierce, and I'm a physician dedicated to men's health, sexual medicine, and holistic andrology. Today, I invite you to join me on a journey, one that I promise will empower, inform, and heal. We are going to walk together through the science and stories behind male sexuality, aging, and the role of self-stimulation in building resilience, joy, and dignity past the age of 60. For centuries, masculine sexual health was wrapped in taboo and silence. We all remember stories from childhood that warned us, sometimes using fear, sometimes using myth, that masturbation would weaken us, sicken us, or diminish our value as men. Entire generations of men across Europe grew up with anxiety, shame, and insecurity just for simply exploring the most natural aspect of themselves. But as medicine evolved, as brave patients began speaking honestly in my clinic and beyond, the truth came to light. Masturbation is not a source of shame or harm. It is one of the most effective, accessible, and powerful tools for maintaining physical, mental, and sexual health in the mature years. Let's begin with the basics. What actually happens in the body during and after masturbation? The journey starts in the brain, which orchestrates everything. The hypothalamus and limbic system fire up, releasing dopamine, the neurotransmitter of anticipation, pleasure, and motivation. You feel energized. Endorphins rise, natural opioids that diminish pain and produce euphoria. Testosterone is mobilized, not only boosting sexual desire, but also supporting muscular, skeletal, and cognitive health. Nitric oxide is released by endothelial cells, relaxing smooth muscle of penile arteries, increasing blood flow, and producing an erection. The prostate and seminal vesicles, those remarkable glands tucked deep in the pelvis, contribute their rich fluids containing zinc, citrate, and specialized proteins, nurturing sperm and protecting urinary and reproductive tract health. At climax, rhythmic contraction of the pelvic floor muscles, bulbospongiosis and ischiocavernosus, is supervised by the pudendal nerve, sending waves of satisfaction to the brain and body. A flood of oxytocin brings relaxation, warmth, peace, and bonding. Stress hormone cortisol falls, prolactin rises, appetite and tension decrease. You sleep better, feel calmer, and have more positive emotions for hours and days afterwards. Now, imagine this cycle, played out regularly, gently, and mindfully, throughout your 60s, 70s, 80s, and beyond. What are the medical benefits? Modern clinical trials and epidemiological studies have established maintenance of erectile tissue, elasticity, and vascular endothelial health, lower risk of benign prostatic hyperplasia and prostate cancer. Men with the highest frequency of ejaculation have up to 30% less risk, according to Harvard studies and large European cohorts. More stable testosterone levels, mood, and metabolic function. Improved cardiovascular conditioning, heart rate and blood pressure rise briefly, much like moderate exercise, training the heart without strain. Better quality sleep due to oxytocin and prolactin release. Enhanced psychological resilience, reduced depression, anxiety, and loneliness. Lower chronic inflammation and better immune function. Let's pause here and listen to the voices of real men from Germany, Austria, Sweden, Italy, and France, who have come to my clinic and allowed me to share their stories. Marcus, age 67, from Vienna. I thought insomnia was a curse of aging. I felt tired all day and disconnected from my wife. With gentle advice, I started practicing self-stimulation, not as a guilty escape, but as a sleep-enhancing ritual. It worked. After weeks, my nights became peaceful. I woke energized, confident, and closer to my wife. Giovanni, age 74, from Milan. My prostate enlarged, urination became a struggle, and I felt much older than my years. Rather than resign, Dr. Pierce taught me pelvic floor exercises and safe massage, combined with regular mindful masturbation. The improvements were remarkable: less urge, better flow, stronger self-image. Andreas, age 65, from Berlin. I had dry orgasms, the sensation of climax without ejaculation. I panicked. With clinical support, we explored perineal warmth therapy, breathing, and slow touch. No medication. Satisfaction returned. Anxiety faded. I realized aging meant adaptation, not defeat. Edward, age 69, from Stockholm. I saw testosterone drop and libido fade. My marriage suffered. Dr. Pierce designed an evidence-based program: resistance exercise, omega-3, zinc, daily aerobic walks, and moderate masturbation. My hormone levels stabilized, intimacy revived, and my sense of manhood restored. Now let's go deeper, far deeper, into the medical foundations. As men age, the testicular Leydig cells produce less testosterone. This hormone is the backbone of male vitality, muscle, bone, sex drive, energy, and cognitive sharpness. Deficiency leads to sarcopenia, muscle loss, osteoporosis, insulin resistance, fatigue, and depression, alongside sexual dysfunction. Meanwhile, the cardiovascular system faces new challenges: arterial stiffness, endothelial cell dysfunction, and reduced nitric oxide production lower blood flow everywhere, including the penis. Erectile dysfunction is an early warning sign for heart disease, stroke, and vascular dementia. The prostate also undergoes profound changes. It may enlarge, causing weak stream, hesitancy, and nocturia, night urination. Chronic inflammation, sometimes called prostatitis, is common, and silent buildup of old seminal fluid can elevate risk of infection and cancer. The nervous system adapts. Sensory nerves in the penis and pelvic floor lose sensitivity. Response slows, intensity fades, and men can feel disconnected from their previous sexual selves. So how does masturbation counter these effects as a medical protocol? First, erectile tissue maintenance. Every erection floods the corpora cavernosa with oxygen-rich blood, sustaining the endothelium and preventing fibrosis. It's like aerobic exercise for the penis, absolutely vital for preserving function. Second, prostate cleansing. Regular ejaculation flushes out stagnant prostatic fluid, debris, and inflammatory cytokines, lowering the risk of hyperplasia and malignancy. Third, hormonal signaling. Sexual arousal and climax repeatedly activate the hypothalamic pituitary gonadal axis, telling the body to maintain testosterone production. You're training your hormones not to slip away quietly. Fourth, cardiovascular workout. Heart rate increases, peripheral resistance falls, and vascular flexibility grows. Sexual activity, even solo, counts as moderate aerobic exercise. Fifth, neurological and psychological enhancement. Each session boosts dopamine, oxytocin, serotonin, and endorphins. It is literal medicine for anxiety, depression, and cognitive aging, shown in MRI and hormone studies. Sixth, sleep and immune enhancement. Post-orgasm, oxytocin and prolactin induce deep sleep. Quality sleep is essential for immunity, mood, metabolism, and mental clarity. Seventh, emotional and self-identity health. Aging men are pressured by negative stereotypes around sexuality. Masturbation is an act of self-love, reclaiming connection, sovereignty, and meaning. Let's address clinical techniques. Pelvic floor therapy, daily Kegel routines, tighten, hold, release pelvic muscles, help direct blood flow, ejaculation, and urinary function. Combine with biofeedback, simple at-home devices monitoring strength and endurance. Perineal heat application. Warm compresses before masturbation increase blood flow and nerve response. Mindful breathing and progressive muscle relaxation. Slow abdominal breathing. Inhale 6 seconds, exhale 6 seconds. Relaxes pelvic tension, galactic proven by EEG studies to heighten sensation and satisfaction. Prostate massage, clinical, guided by a specialized doctor or physiotherapist only. Gentle, steady pressure improves drainage and reduces chronic prostatitis. Nutritional medicine, zinc, 60-90 milligrams daily from oysters, beef, pumpkin seeds. L-arginine, citrulline, naturally found in nuts, chicken, lentils, supporting nitric oxide and vascular health. Vitamin E and omega-3 fats prevent tissue aging and inflammation. Mediterranean diet, fish, olive oil, leafy greens, tomatoes, proven to reduce prostate and cardiovascular risks. Exercise medicine, brisk walking, swimming, cycling, or resistance training, weights, bands, 30 minutes per day, 5 times per week. Squats and lunges specifically target pelvic circulation and strength. Sleep optimization. Block blue light 2 hours before bed. Use amber glasses. Keep a consistent schedule. Support with magnesium 400 ml and ashwagandha, adaptogen. Psychological support. Cognitive behavioral therapy, CBT, mind-body techniques, men's support groups, sex-positive counseling. Medical management, annual prostate checks, PSA, DRE, endocrine panels, total free testosterone, LH, FSH, estradiol, cardiovascular assessment, lipids, glucose, BP. Pharmacological options, PDE5 inhibitors, sildenafil, tadalafil, vardenafil, for ED, only with clinical supervision. Testosterone replacement therapy, if indicated, done under strict guidelines to monitor prostate, CV safety, and hormone balance. Let us pause for another story. Jean-Paul, age 71, Lyon. Widower. I lost my intimacy for 5 years. With Dr. Pierce's support, I found self-care through mindful masturbation, combining aromatherapy, deep breathing, and music. It wasn't just physical, it was emotional healing. I reconnected with joy and felt finally at peace with my body again. Now, advanced clinical protocols, neuromodulation, electrical stimulation, low-intensity pulsed ultrasound, and vibrational therapy have shown promise in clinical trials for nerve regeneration and erectile improvement. Endocrinology of sexual aging. Understanding the delicate balance of testosterone, DHEA, estradiol, how methylation, sleep, nutrition, and regular sexual activity impact hormone levels. Cardiovascular optimization. Monitoring endothelial function, flow-mediated dilation, reducing oxidative stress with polyphenols, berries, green tea, cocoa, statins if needed, plus regular sexual activity to enhance nitric oxide output. Prostate immunology, anti-inflammatory nutrition, curcumin, omega-3s, lycopene, and the role of ejaculation in expelling immune complexes and toxins. Sensory re-education, tactile retraining using silk, feathers, temperature variation, and gentle touch to reactivate dormant nerve pathways. Partner counseling. For men in relationships, open dialogue around sexual change is essential. Partnered masturbation, shared breathing, sensate focus, tools for mutual satisfaction and emotional connection past 60, 70, even 80. Philosophy of sexual identity. Rejecting the myth that aging is sexual decline. Embracing self-awareness, compassion, and radical acceptance of your evolving sexual body. Let's expand on specific functional techniques. Progressive self-exploration. Take 30-45 minutes in a calm, private space. Begin with non-genital touch, gentle massage, deep breathing, and gradual stimulation. focusing on sensation and relaxation, not immediate orgasm. Build new neural pathways, enhance pleasure over time. Hydrotherapy and sauna. Regular warm baths, sauna sessions, and contrast showers improve pelvic blood flow, clear toxins, and, shown in clinical German studies, reduce symptoms of prostatism and erectile dysfunction. Nutrient cycling. Rotate primary antioxidant and mineral sources. Example: Week 1, focus on zinc-rich foods. Week 2, shift to high omega-3 and vitamin E intake. Track mood, sleep, energy, and sexual satisfaction, adapting protocols for individual results. Biohacking sexual health, sleep tracking, HRV monitoring, testosterone and nitric oxide urine strips, mindfulness apps. Integrate personalized data to optimize lifestyle routines. For men confronting disease, post-prostatectomy rehabilitation. After surgery, gentle masturbation helps restore nerve function and blood flow. Pelvic floor training accelerates continence, sensation, and self-esteem. Cardiovascular recovery. Patients recovering from heart attack or bypass surgery benefit from slow, monitored sexual re-engagement, beginning with solo gentle touch and mindfulness. Diabetes management. Mindful masturbation reduces stress hormones, which improves glucose control. The mechanical act also enhances penile blood flow, reducing neuropathy risk. Mental health. Chronic depression, anxiety, and loneliness can be measurably improved through regular, pleasure-focused self-stimulation, combined with supportive therapy and community. For all men, periodic medical review is essential. Work with a doctor skilled in sexual medicine. Monitor hormone panels, cardiovascular markers, and prostate health. Keep a detailed health journal, tracking sexual function, pleasure, mood, and energy. Let us pause with yet another story. Magnus, age 77, Stockholm. I lived in silence and loneliness after my wife died. Dr. Pierce encouraged me to try a self-compassion protocol, meditative masturbation. Every morning, I sat in sunlight, breathed deeply, touched myself with care and attention. It wasn't sexual only, it was spiritual, healing. My blood pressure normalized, my mood elevated. I felt truly alive again. For those who struggle with shame, guilt, or cultural barriers, sexual aging is not an ending, but an invitation to growth and discovery. Let go of old beliefs that say sexuality after 60 is futile or wrong. Embrace scientific truth. Pleasure, touch, and sexual health are vital for physical and mental well-being. For women partners or widowers, solo sexual self-care is equally restorative. Many share that reclaiming self-touch revives energy, hope, and joy. If you experience pain, new symptoms, or distress, always consult your physician. Never self-diagnose or ignore changes. Now, advanced practical tips. Combine masturbation with stretching and yoga to relax pelvic tension. Use coconut oil or medical lubricants for smoother, safer stimulation. Change positions, lying down, sitting, legs elevated, to explore new comfort and pleasure. Incorporate music, aromatherapy, or guided meditation to heighten relaxation and sensory experience. Share your health journey with trusted friends or support groups, breaking silence, growing in confidence, and finding community. Remember, moderation is key. Quality matters more than quantity. Listen to your body. Let pleasure become mindful, deliberate, nurturing. Let me offer a specific 30-day protocol for optimal sexual health after 60. Days 1 to 7, focus on nutrition. Add zinc, arginine, vitamin E, omega-3s, cut processed sugar. Days 8 to 14, incorporate daily pelvic floor exercises and brisk walking 20 minutes. Days 15 to 21, practice mindful masturbation, 30-45 minutes, full body relaxation, slow touch, deep breathing. Days 22-30, add warm perineal compresses, sauna, and sleep optimization. Magnesium, fixed bedtime. Track changes in energy, mood, function. Upon completion, reflect, adjust. Celebrate progress, compassion, and vitality. Now, a final word on dignity and thriving sexual identity. At every age, the body is your companion and ally. Cultivate gratitude, patience, and exploration. What was once condemned as shameful is now embraced as medicine. Masturbation after the age of 60 is not only acceptable, it is essential. It preserves tissue, balances hormones, protects the heart, sharpens the mind, and heals the spirit. To each man listening, your pleasure and well-being are sacred. To partners and families, support, understanding, and love heal more deeply than any medication. If this wisdom brings confidence or hope, share it, comment, subscribe for more. Join me, Dr. Lauren Pierce, for regular lessons in science, self-care, and holistic masculinity. Let us move together toward a life of health, fulfillment, and joy far past our 60th year. The journey does not end here. Body, mind, heart, and spirit all can flourish. Thank you for listening and caring for yourself today.